To me, it was surprising, but there's a very consistent finding in epidemiology that alcohol increases your risk of breast cancer. It seems to be a dose response. Well, it's not so clear. A lot of the reports show a very low amount of alcohol still increases your risk. I've always been a little skeptical about the amount, because if you take from epidemiologic studies and estimate how much alcohol would be used in the United States, and then you compare it to sales figures, a lot's dumped down the drain. And that's hard to believe. But also, you can't separate men from women, but there are people thinking that older women tend to underestimate what they tell you. No.
Well, Peter, to be fair...
One more thing.
If I may, when we were in training, we were all taught explicitly the multiplier factor, which is exactly double what anybody tells you.
Yeah, it might be even more. 5 to 1. One thing is that there's some suggestion, I don't know if Walter Willett wants to mention this, but that folate may limit any adverse effects of alcohol.
Yeah, Walter, you've commented on this in prior years, actually. Maybe you want to give us a refresher. Here you go. And introduce yourself, please.
Right. Well, thanks. I think, as Peter said, the evidence that there is this dose-response relationship with increasing alcohol intake and higher risk of breast cancer is very firm now. It's in dozens and dozens.
So not everybody, forgive me, not everybody in the audience will know dose response. That just means the more you get, the more the bad thing or good thing happens. In this case, bad thing.
Right, yeah. But there's quite a bit of evidence, I think it's not absolutely proven, but pretty good evidence that the biggest increase is in women who also are low in their intake of folic acid. So how do you make sure that you're not going to be low in folic acid? One thing is to eat lots of fruits and vegetables, and the other thing is to take just a plain old multiple vitamin. You don't need to take megadoses. This is just getting out of the really low folic acid area. So it's not a good idea to be low in folic acid intake for a whole lot of reasons, and particularly if you are going to drink alcohol, even one drink a day, where we do see a modest increase in risk, it's good to make sure that you're getting adequate folic acid. And so I think as a safety net, taking a multivitamin is a good thing to do.
Why don't we fortify the booze?
Pardon?
Why don't we fortify the booze with folate?
Well, we are in fact. Oh, the booze itself, yes. Actually, the FDA doesn't allow any fortification of alcoholic beverages.
Larry.
I want to say something political, because I'm sitting here at the end specifically so I can get out of the room quickly before anybody throws anything at me, is that, vegetables are really good for you. But like really good for
so
you.
Controversial.
All right? And this is not, we could talk about, fine-tuning stuff, whatever, too, but, many of you I know, because I know many of you are in a position where this piece of information is important for you to think, is that, we talk about various things, and Peter alluded to it, that we could change in our environment that can make a big difference. Right now, the farm subsidies for wheat, corn, and soy is about $19 billion. That compares to a National Cancer Institute budget for all of cancer research put together that's under $5 billion. And about half of that $19 billion is really going into making corn starch that's used to make high fructose corn syrup, which is a major ingredient in soft drinks, which is the major cause of childhood obesity, leading certainly to diabetes and probably all these other diseases that we're really talking about. And there's a direct linkage there in that regard. And so, it really is. And by the way, the soft drink market, aside from that $19 billion, the soft drink market is about $68 billion. All right. Remember, we're talking about $5 billion, the entire National Cancer Institute budget. So that, there's things that we could do beside our own lives, we could do for other people by being aware, really, of these numbers. There's much more money being spent, in our country on, dramatically more money being spent on giving people diabetes, heart disease, cancer than on trying to solve the problems such as we're talking here. And you just got to keep this in mind to ask politicians, and there are indeed politicians in the audience too. There are people in government office here too. Got to keep these things in mind. We really can make a gargantuan difference by fairly simple things in that regard. I'm not saying not to pay farmers, but if we paid them to grow vegetables instead of growing corn, it could make a dramatic difference in the incidence of all these diseases.
So. We have two of our grantees
Yeah,
who
let me
want
just
to
add one
speak up.
thing
Sorry,
first.
Peter?
One, that soft drinks does not mean only soda. A lot of these so-called fruit drinks have a high fructose corn syrup. They have a lot of calories.
Yeah, thank you.